Welcome to Module 2, Take 2 Steps to Prevention. In this module, we will describe the 2 Steps to Prevention framework and the trajectory of health inequities. These tools can be used to describe why a focus on the environment is essential for health equity efforts. After completing this module, you will be able to discuss the 2 Steps to Prevention framework, identify elements in the trajectory of health inequities, and use the 2 Steps to Prevention framework to move from a primary focus on health services to emphasize the role of the environment in creating and reinforcing inequities. Taking 2 steps to prevention will help you to address the reasons why people are disproportionately sick or injured in the first place. In Module 1, we described the prevention continuum and emphasized the importance of primary prevention for achieving equity in health and safety through a set of systematic strategies. We also introduced the concept of health inequity, which reflects a recurring pattern of differences in health outcomes that are not randomly distributed, but predictable based on race and ethnicity, social status, class, and income. Inequities are not only unnecessary and avoidable, but also are considered unfair and unjust. To provide a visual representation of how inequities are created and where primary prevention strategies are most effective, Prevention Institute developed the trajectory of health inequities. Here, the circles, decreasing in size, represent the relative contribution to increasing inequities. This means that the environment has the largest contribution. The arrows, increasing in size and darker in shading from left to right, reflect growing inequities and increasing poor health status. Elements along the pathway combine to produce increasing inequities in health and safety. Moving from right to left, let's look at each element of the trajectory. Traditionally, a focus on healthcare services has been a core strategy for addressing disparities in illness and injury. When heart disease, cancer, and injury is characterized as the problem, it is easy to see why the response would be more healthcare services. Quality care, proper screening, and culturally competent services are critical for reducing inequities. Inequities in illness and injury create a differential need for healthcare services among specific populations. Differences in access to and quality of care further contribute to inequitable outcomes. A landmark report by the Institute of Medicine, Unequal Treatment: Confronting Racial and Ethnic Disparities in Healthcare, shows that people of color experience disparities in treatment across all socioeconomic levels. This report also provides strategies for addressing these disparities. We know that equitable healthcare is critical, but we also know that services alone cannot reduce inequities in health and safety for several reasons. First, healthcare services are not the primary determinant of health. Second, healthcare services treat one person at a time and focus largely on specific illnesses and injuries as they arise. Finally, treatment often comes late and does not always restore health. Healthcare services usually come into play after illness or injury occur, and many common chronic health problems such as heart disease, diabetes, asthma, and HIV/AIDS are never cured. In addition to ensuring proper healthcare access and treatment, we need to also identify what is causing people to get sick and injured in the first place.